think we're probably good to go anytime, Kevin.
Great. Well, thank you, Paul. I want to welcome everybody this morning to our Health and Wellness Committee meeting. Just a great, beautiful day on March 4th, 2026. And we appreciate you all being here. It's obviously a gorgeous day in Charleston. It's such a great time of year in the city of Charleston as we move into spring. And March, as you know, is an exciting month for Charleston. You see Paul's background there with the Cooper River Bridge Run. That's going to be March 28th. We're going to have about 40,000 people running away from Mount Pleasant and into the great city of Charleston. We appreciate Mount Pleasant and what they do for us as well on this and being a great partner in that event. And of course, this week we've got the Charleston Wine and Food Festival happening. We're going to have so many residents and visitors enjoying our parks, our walking trails, our waterfront. And of course, this weekend we're going to spring ahead. We're going to change our clocks for an additional hour of daylight after work. We're going to talk about this a little bit today, but it's National Nutrition Month. We've got some notable birthday notable birthday. William C. Boyd, immunologist and chemist who made the first worldwide survey of the distribution of blood types. So his birthday today, he lived 1903 to 1983. And this day in 1985, the Food and Drug Administration approved a blood test for HIV infection. So important day in history. And I just want to thank you all for being here. Thank all of our community partners, all our city staff for your continued work in helping our city of Charleston a healthier place to live, work, and raise a family. So with that, let's move forward with our agenda. Paul sent out minutes from the last meeting in February, from February 4th. Can I get a motion to approve those minutes, please?
So moved.
I have a motion to approve. Can I get a second?
I'll second.
Thank you. I have a motion to approve. We have a second. Any additions, deletions, or any comments on those meeting minutes? If not, all in favor of approving those minutes, please say aye. Aye.
Aye.
Any opposed? The minutes have been approved, and I want to thank Jennifer Brush for filling in and for leading that meeting last month. Thank you so much for your work. Appreciate that. Next on our agenda, we have Laura Nance is with us. She's going to talk with us about Go With Your Gut, nutrition habits for a healthy gut. She's a RDN CDCES with MUSC Office of Community Engagement. She's a registered licensed dietitian and nutritionist. Laura, if you would, thank you so much for joining us and giving us some information this morning.
Oh, great. Thank you for having me. I'm so excited to be here. Paul, you said I should be able to share my screen. Yep, let's see. I'm going to give this a shot. I think this is happening. Okay, am I sharing?
No, not yet.
Okay. And Paul, if you want to, I sent it to you if you want to try.
Okay. Just a second.
Oh, I think I might just have it.
Yep, you got it.
Dun, dun, dun. Sorry about that. Let's see if I can make this bigger. Okay, how's that work?
Good.
Thank you. All right, well, thanks for having me. I'm from MUSC, Office of Community Engagement. And what a special month. We get to celebrate National Nutrition Month with the message of discover the power of nutrition. And the months are really just designed to create awareness around what's happening in the nutrition world. This year's theme is to highlight the crucial role food and nutrition play in fueling physical health, mental well-being, and disease prevention. So it's really just about empowering people to recognize how food really plays a role in their lives. The other thing we're going to talk about today is March is Colorectal Cancer Awareness Month. So again, these are just designed to bring awareness to what's happening around us. So we're just going to share a little bit about those things. Probably not the most pleasant photo to be seeing first thing in the morning, especially if you haven't eaten, but it's real. Colorectal cancer is basically any cancer that starts in your colon. And obviously the colon is the large intestine. It's the last place that, food is in your body. It's just below the small intestines where we've had lots of nutrient absorption. Usually what happens in the colon or the large intestines is water is absorbed from your food, kind of that last stage. So any cancer that starts there, they would call colon cancer, colorectal cancer, and usually starts with a polyp. I think you see that on the right-hand side of that slide. That's typically benign at first, but can turn cancerous. So that's the concern. And the awareness is really about getting screened so we can take care of those polyps before they turn into cancer. A little bit about the stats. I always like to know why we're talking about this. Why is it so important? We have about 158,000 diagnoses of colorectal cancer each year. It's the fourth most diagnosed cancer in the United States, and it's pretty gender neutral. You'll see it affects men and women pretty equally, but unfortunately, the fatalities are more among men than women. It's the second leading cause of cancer deaths in the United States. We talk a lot about breast cancer and lung cancer, but this is one that's certainly up there. So we want to be mindful of it. And one of the more alarming statistics I learned about was that although the rates of colorectal cancer especially deaths, are decreasing overall, we're seeing increased rates of diagnoses and deaths in those under the age of 50. So I think it's great to bring awareness to everyone. We generally do think about this as an older person's disease, and we do see it afflict older persons more, but we are seeing this trend rising in those under 50. So something to note. And then the other thing, again, why we talk about this so much is when we catch it early, 90% of the cases can be beaten, which is great. So all right, so what are some of the risk factors? On the left-hand side of the screen, you see those risk factors that we can't really do a whole lot about. Age, racial background, gender, and again, pretty gender neutral when it comes to diagnoses, but the fatalities hit the men more so than women. If you've had a gallbladder removed or family history of polyps, history of irritable bowel disease, and then certain inherited syndromes. So those are things we can't do anything about. So we like to focus on the risk factors that we can change. Smoking puts you at risk for colorectal cancer, excessive alcohol intake, excess body weight intake, type 2 diabetes. Now, this one was kind of iffy about which column to put this in. Although it's not always preventable, we do know that there are some prevention methods for type 2. So I would say this probably crosses both of those columns. But those with type 2 are more at risk. Physical inactivity puts you more at risk. And obviously, the thing that I like to talk about, the diet part of this. The literature tells us that more than half of colorectal cancer diagnoses are linked to habits that can be changed. So again, this is a great subject for us to talk about. All right, so what are some of those risk associations? We know that you're at an increased risk for this type of cancer with regular consumption of processed meats, and those are things like bacon and hot dogs, anything that's been cured, red meats, high temperature cooking, and this one's a little bit more controversial, but that's that super high heat on the grill, that charredness on the grill, the consumption of animal fats, lots of sugar in your diet, and again, the alcohol use. So those are the risks, the diet associations that we know increase our risk. The diet associations that we know decrease our risk are getting lots of fruits, vegetables, and whole grains. So it's really where I'm just going to focus the next couple of minutes. And this is super casual. So if you guys have any questions, please just throw them out there. So we like to emphasize plant-based proteins as a way to get more fiber in, as a way to kind of get rid of some of those animal-based proteins that are higher in that saturated fat. Lentils, black beans, cannellini beans. What I've listed here are really just the top fiber foods in each of these categories, but we're really talking about any bean, any vegetable, any fruit. Chia seeds, almonds, pistachios. These are really great things to work into your diet if you can. Vegetables, obviously green, leafy all the way, but we also have some other great ones: broccoli, acorn, squash, peas, potatoes with the skin, cauliflower, carrots. And again, these are foods that are generally higher in fiber in their food category. Promotion of whole fruits like berries, apples, pears, bananas, oranges, strawberries, anything with that roughage. And even if you can get the skin on it, I would encourage you to always wash your fruits and vegetables well. If we can maintain the skin intact and consume that, it's going to be beneficial as well. And then whole grains. So emphasis on whole grains, quinoa, barley, oats, buckwheat, brown rice, popcorn, anything that's a grain that says the word whole in front of it is going to be in this category. Couple of other notes. These, again, are foods that are really high in fiber. They provide that roughage and get things moving through your large intestines, which is beneficial. We've got some other great bonuses for getting fiber in your diet too. But if you're tracking your food intake by any chance, I would encourage 25 to 35 grams of fiber per day. If you're not anywhere close to that, we probably want to work your way up. It's not super comfortable to slam a bunch of fiber in your gut. But this is generally going to be the number that we're aiming for all chronic disease prevention besides just cancer risk prevention. So the other thing I want to mention here, I think there's a lot of talk in the media about the gut microbiome and having a healthy gut microbiome. All of these foods listed here and any food in the vegetable, fruit, bean category, whole grain category, the foods that provide a lot of fiber in our diet are actually going to contribute well to a healthy gut microbiome. And we know that healthy gut microbiomes are linked to a lot of chronic disease prevention. So this is kind of a bonus right here is what I would say. And this picture is really just to remind everybody, like there are lots of different methods to eating. We've got on my plate, we've got the diabetes plate, we've got healthy Harvard plate, we've got a vegetarian plate over here. And it really is not about eating a certain type of food, like 52 blueberries or green dried coffee beans. We're really looking at, food as a holistic approach. And as long as we're getting vegetables in, whichever ones you like, totally fine. As long as we're getting some whole fresh fruits, as long as we're getting some whole grains in there. So this just kind of hopefully opens up the door to say, hey, I don't have to eat a specific way like the Mediterranean diet, which is great, by the way, but we don't have to eat those specific foods. It's really just about getting the foods in those categories. So lots of different options to be very flexible here. So the other thing I believe Paul asked me to talk about today was the dietary guidelines. And again, this kind of all comes together. So the dietary guidelines for Americans, we had this newly published ones in 2026. It's an upside down pyramid. And there's a couple of things to just kind of note about it. The message here is to eat real food, which is fabulous, right? So some of the things that we can certainly get on board with would be real food, whole food, fresh food, less processed food, less food with sugars in it. So increasing your intake of the vegetables, whole grains, fruits, the same exact foods we just talked about to decrease your risk for colorectal cancer. Again, limiting processed foods and added sugar, focus on fiber and the microbiome. These guidelines actually suggest that. And then drinking calorie-free drinks. And obviously the drink of choice would be water, but anything calorie-free for sure. So now kind of more on the questionable, controversial side, my professional guiding academy is the Academy of Nutrition and Dietetics. And there are a couple of things on this pyramid, upside down pyramid, that we're like, I'm not quite sure about, not sure where the evidence came from. So a couple of things that we would say, tread lightly on. The inclusion of red meat in the larger part of the pyramid and the inclusion of whole fat cheeses and milks is something we're not sure really where the evidence comes from. So I would still tread lightly. That would be my suggestion to my clients. These foods do have a significant source of saturated fat, and we know that there is a risk association with heart disease and some other chronic diseases with that. So, and then the regular consumption of, I cannot see that on my, let me slide this over there. Yeah, the red meat, I already addressed that. Yeah, so, and then the other thing is the protein recommendations for the new guidelines are a little bit higher than we generally advise. There are certainly some subsets, some subgroups and populations that do need higher protein, but most Americans generally get enough. So those are kind of some of the questionable things about the pyramid. I believe overall the message is whole foods, less processed, lots of fruits and vegetables and whole grains, and those are certainly good messages to take. Does anyone have any questions about the guidelines at all? It's kind of a bigger thing to address, so I just wanted to at least put it up there and let you know what we're talking about. Okay. And then lastly, just kind of a closing here, take home messages about National Nutrition Month and, colorectal cancer risk, since it is that awareness month, is eating well. Again, that looks different for everyone. We're just really focusing on a healthy eating pattern with plant-based proteins, whole grains, fruits, and vegetables. Exercising regularly is important, and we kind of go with the standard 150 minutes per week if you can do that. The more the better, though. Watch your alcohol intake. Some of the latest health organizations like the American Cancer Society and the American Heart Association are really saying, hey, if you don't drink, that's great. There's no reason to pick up any kind of drink for any health benefit. And if you're over 45, get screened for colorectal cancer. If you're under 45 and have other risk factors, you might want to talk to your doctor about getting screened earlier. And obviously, don't smoke. So those are my messages. And if you have any questions, feel free to email me. I'm happy to take any on this stream as well.
Great. Thank you so much, Laura. Very good presentation. Susan Johnson has her hand up. Susan?
Oh, I just wanted to clap because
Oh, I'm
Laura
sorry.
is my colleague, and I love hearing her talk about her profession and everything that she does. So yay, Laura, thank you.
Oh, thank you, Susan. It's been a pleasure. I appreciate it very much. And Paul, feel free to share the slideshow as well.
Great. Thank you, Laura. Laura, let me just ask a question. I know, there's times when you have a colonoscopy every 5 years if there's a polyp found and things like that. Are there other ways of finding, can this be found through blood tests and those types of things as well?
That's a great question. I know there is a delivered to your home kit, but I'm not sure exactly who qualifies for that. I'd have to look that one up. I have a good conversation with your doctor. And then obviously, besides the standard screening, just being mindful of what's happening with your body. If things start to change, then that's a good time to have a conversation with your physician. Say, hey, I've noticed something a little different in my daily routine. I just wanted to bring this up. Is there anything I need to do about it?
Great. Well, thank you so much. We appreciate that. Any other questions for Laura?
Yes. Hi, this is Dr. Kay Durst. I'm sorry I'm stuck in traffic. Can you hear me?
Yes, ma'am. We can hear you.
Yes, I just, by the way, thank you for that presentation. It's awesome. I'm a family medicine doctor, so we deal with this a lot. And you asked about the screenings. So yes, the colonoscopy is the gold standard, as Laura said, 45 and up, unless you have a family history or any issues, rectal bleeding or stomach issues. There is Cologuard, which is the one that they send to your house. Most insurances pay for it. It is not the gold standard, and it is not for people that have rectal bleeding or family history or a history of polyps. But a lot of people don't know about the Cologuard. They send it to your house. If it's you get the stool, you send it back to the company, and they get the primary care doctor or the GI doctor. They give the results. If it's negative, the chance of having a polyp are pretty low. It's not 100%, but then you're good, but you have to repeat it every 3 years. If it's positive, it doesn't mean you have cancer, but it means you could have a polyp that is a precursor to cancer, and you still have to get the colonoscopy. So a lot of people are afraid to get the colonoscopy, but this is a good way to get screened. Most insurances cover it. There is a blood test. It's a Shield, but it's only just recently been out. It's not covered by many insurances, and a lot of physicians prefer not to do that, but there's a lot of research coming in the future for it. There's also once a year FIT testing, which are just checking for blood in the stool. And I know right now Roper is doing some free colon cancer screening, and I'm sure MSC is doing some other things too. And another quick thing with the colonoscopy, a lot of people are really afraid of the drinking and all too. A lot of the physicians, they're pills, so it's a lot better for the prep. So it's a great way to save your life, and of course we all know about it. So thank you all so much for bringing this up.
Thank you, Dr. Durst. Appreciate that. Thank you so much.
Well, Kevin,
Paul?
while she's on, I will give a plug. Farmers markets are starting to open. Charleston's farmers market will open after the bridge run, the 1st of April. So great resource, and we've got a wonderful asset of having them in our community. So please take advantage of them.
Very good. Well, thank you.
Yeah, that's great. I think y'all do have a CSA coming to 75 Calhoun as well.
We used to. We relocated out of 75 Calhoun, and I'm not sure if where it's difficult if we're in so many different offices right now, but we're working on it.
Okay, and I do, at Gruber Farms, they did tell me they are going to still drop off there if anyone has access. And we do have the drop off at Wellness Center at MUSC as well. So it's a great way to expand your variety of fruits and veggies.
Very good.
All right. Well, thank you guys so much. Have a great day and have a
Yeah.
yummy lunch.
Thank you so much, Laura. Great presentation. We appreciate it. Thank you.
Bye.
And next up for our community health update, we have Lamar Hodges with the South Carolina Department of Public Health. Let's see. Are you on there, Lamar? Yeah, you're on there.
I am. Good morning, everyone. Of course, I'm so glad that, of course, great presentation, Laura, because, you know, I am a nutritionist at trade. So I was so happy to hear all of the great work and the understanding of what it is that MUSC is doing, as well as all the others when it comes to just bringing that awareness to National Nutrition Month. So I don't have many things to share this morning. One of the things I do want to share is, of course, when it comes to the Department of Public Health, of course, we are still going into space where we do our free testing day. We do this monthly, and of course, our free testing day is March the 12th of this month. This is just an opportunity for those in the community who just feel the need to want to go in that space of just being tested for STI. This is a great way in a space where we're accepting clients to be able to provide free testing, either free or at low cost. I also want to go in a space where today I'm going to share my screen. I know oftentimes in situations I've been kind of providing updates regarding the measles, but today I want to go in a space of having you to follow me as we guide through our website and our dashboard that we've kind of been keeping up with the information regarding the measles. So just give me one moment. I'm going to share my screen, and then we're going to get started from there. Alrighty, so, and hopefully you can see our website here, and where we are is, of course, as it pertains to our website, you can always visit us at dph.sc.gov. And of course, immediately when you get on the page, you can see right here at the top, it already brings you to the space where it talks about the 2025 measles outbreak. So I'm going to click up here to the outbreak page. One of the things that I wanted to do more so is just kind of share some information in regards to some things that we may have discussed in the previous meetings. But of course, keep in mind that every Tuesday and Thursday of the week is that we have our agency, especially down there in the what we consider as the upstate area. We do have where those members of our team actually have briefings, and they really go into space of kind of deciphering and going through there and trying to figure out ways that we can be able to assess and be able to provide information to the community, as well as much more information of how to protect themselves in regards to the measles. This web on the web page, it does provide information in regards to what has been discussed in the meetings. It also provides the information as it pertains to how many cases we are at currently now. And then, of course, it also even gives us a dashboard and breakdown of what those look like. And we're going to go in that space next. I also wanted to share that it even kind of provides you with the information where those public exposure locations are, as it pertains to the date and time and last when it was occurred. So that's very important, so that therefore, you know, we're keeping ourselves abreast of where to travel and when those exposures are occurring. Of course, one of the great things that we were grateful to have is that we have a mobile health unit that is in that area as well. And of course, throughout the time frame, throughout the year, we're providing the MMR vaccine in regards to 2 dosage to be able to assist those in regards to, and a booster, I should say, as well. Just providing to go into space, and you'll see in areas of when we go to the dashboard why that is important as well. But you can also go and, like I said, be able to understand and see those, understand and be able to read up on the briefings as it pertains to what is being discussed in those meetings, as well as the news releases as they constantly post those every week. But I really want to go strictly to the area of the dashboard. So we're going there and just kind of sharing the information in what we have before you. So, of course, what we've done when it comes to the Department of Public Health, we've gone in a space of definitely, I will start off, and I should have started off with my disclaimer that I am not an epidemiologist, so this is not my area of expertise. However, we are subject to look at data oftentimes in community engagement, which is how we are able to be able to meet the community needs, oftentimes in situations of being able to work with them in those areas of what is priorities. I will say that, of course, you'll see here, based on the graphs that are shown here, that we've went in a space of categorizing this based on the information you'll see based on the measles cases by confirmation of the week. You'll see there by the county, by the vaccination status, which kind of we'll go into that, and very well of understanding it by the age group. And I just want to basically touch bases on the number of cases confirmed by week. And you see there, as you know, we're rapidly, it was a decrease. If you look closely when it comes to understanding, of course, from the month of January to February. So, of course, we're going in a space, which is what we want. We want for a decrease in that, in the numbers. Of course, is like I said, each week we're basically identifying and providing those numbers in regards to how many cases. One great important one that I was grateful for is to understand how they have categorized this and placed this based on geographics. It's very important to look at that as we are, constantly seeing where there is the cases are and where they are rapidly, continuously to increase. Like right now, we're currently, as of today, we have over 990 cases that have been determined through our agency. And so going forward, when it comes to the information, I just want to share it, just kind of give that highlight there of the information that's shown. As you see, it is very prominent there in the Spartanburg upstate area when it comes to those cases. And I'm going to go in a space of breaking down when it comes to the vaccination status. You see here as it pertains to compared to those who are fully vaccinated, partially vaccinated, and even in the space where we are those who are unknown, and that could be very well where their status has not been determined or they prefer probably not to give a status, is where we are looking at as the numbers are not as extreme versus those who are unvaccinated. I did go in a space of thinking, really diving a little bit more into this space where it even give the information regarding the age groups, right? So that is, of course, when it comes to those age groups and understanding that, you see here as it pertains to those who are 18 and older, you see about as much as about only 85 persons who are actually have been determined to have measles versus those who, as you can see, it's rapidly really affecting those children from ages 5 to 17. So that is really where our focus is when making sure that those children and those parents understand that the importance of vaccinations for those age groups. As you can tell, mostly in the situation, that is just based off of what I've determined, based on the information that is provided, is that we recently are seeing where there's a cause of those, most of the locations are normally at local churches, because there's places where large groups of people are gathering from local churches, grocery stores, and restaurants. And so, of course, in the same space, we go in the area of educating and providing, just because you see where there maybe those symptoms are, being aware of what those symptoms are and making sure that you go in a space of consulting with your primary care physician, always in a space of, emergency or urgent care, just kind of to be on the safe side before going into these public areas. Because oftentimes, we know what happens when it comes to the 3 to 4 days that still lingers in that area. So we got to make sure that we're just taking those precautions. And so, like I said, we've gone into space as it pertains to our agency of offering those vaccinations to basically kind of provide the just another ways that we can go into space of improving and reducing the amount of measles that have been occurring. I wanted to give pause for just a moment and ask, are there any questions regarding this area?
Any questions from anyone? Lamar, I guess I have a question. I know you, like, for example, you listed Spartanburg Costco a couple of times. I mean, are there warnings put out in that area? Are we asking people to be careful or stay away from those particular? You see Costco's listed on there twice. That would be a concern to me. Oh my gosh, that's where I got to go pick up my prescription. That type of thing.
Right. So not necessarily, the goal here is, of course, we're sharing that information as it pertains to just those past exposures, in that area. Because for one, even if, for example, if you have to pick up your prescription, we don't want you to go into space, for example, if you're non-vaccinated or in that space of being vaccinated, we want you to kind of really know what areas that it is occurring, so that therefore, at least in during that period of time, you'll know, hey, this is where it's affected, and this is probably where you may want to kind of stay away from for a certain amount of time until, we get a green light to be able to go in that space where it's safe. We think that is, and I think and I should say, I think that is a great opportunity for us to kind of be able to educate the people in the space of knowing where these exposures are occurring, because of the fact that it allows you to take those precautions that are needed for yourself and
Okay,
your
great.
family.
Yeah, thank you, Lamar. Appreciate that. Any other questions at this point? All right, thank you.
Okay, so I want to move forward into just kind of just sharing the information. I'm gonna try to stop sharing at this point if I can. Um, And of course, if while I'm trying to stop sharing, if I can, I just also want to go in a space where just to provide some information in regards to just some upcoming initiatives that are going on. And I think I provided those to Paul and Kevin um, as it pertains to that area. Okay, so the first thing I wanted to share is that in the community, we do have the 2026 South Carolina Overdose Fatality Review Workshop. This is a great initiative that is coming to our area, as it is already in the Berkeley County area. And there's also an opportunity for us to go in a space that's going to be hosted there in Somerville at the Low Country Conference Center. The purpose, and just to kind of give a little background of the OFR as we call it, is the purpose of this is a team to conduct a thorough review of preventable overdoses and deaths. Normally, when it comes to what this workshop is doing is trying to provide an opportunity for those members of the teams in the community to be able to join or create and start maintain an OFR board. And what they do is to kind of dive deeper into a better understanding of how and why individuals in the community we have the death as they results to any overdose and ways that we can in the future kind of prevent that. Normally, to ensure a coordinated response fully is addressed, usually we going around and understanding the systematic concerns during the overdoses. Like what, for example, if there was an going a space of if there's anything that occurs, whether it's by law, usually you will have your sheriff office. If there's any other preventable measures that and persons who work in those fields when it comes to overdoses or any type of accidental deaths, they're usually going in a space where they review monthly in regards to ways that we can kind of go in a space of prevention. And it's an awesome opportunity. I would say it's just to kind of go there, attend this. We do have where there is a OFR in the Lexington County, Berkeley County, upstate, and then of course in the Charleston County. So we want to be in the space of just kind of going there, and of course it might be an opportunity for anyone to join the OFR, but definitely want to make sure. Of course, the reservations for this, make sure that you complete that as you see at the bottom of the screen by the 6th, so by Friday. As it pertains to being able to provide that information. Like I said, again, as an opportunity, definitely to be able to kind of get more insight in ways that we can be able to assist in the community, as always. And then, of course, the next community event, if you will. So the next community event that we have is, of course, on this upcoming. I know last month I shared in regards to a love baby shower, and of course this coming Saturday we will have another baby shower. We're of course Department of Public Health. We are partnering with Absolute Total Care as well as the Charleston County First Steps to provide the educational resources as well as those resources that those families may need throughout the community. The event is held this Saturday. And then, of course, it is from 10 to 12 p.m. In the Food Line parking lot on King Street. So we'll definitely be there providing information, as it is important to make sure to cover when it comes to that mom and baby and the family, understanding when it comes to newborn screenings, as well as the importance of safe sleep, as well as car seat safety when it comes to the little ones. So we definitely will be out there and supporting the families that are needed. And that's all I have. Thank you so much.
Great. Thank you, Lamar. Any questions for Lamar? Joyce, did your question get answered? I see you got a question in the comments there. Did you?
It did not. I thought of it after he had concluded his part of the presentation, but there seems to be a lot of age 5 to 11 on there for the measles outbreak. Is it showing in the public school system, or is it are you finding that it's in private schools or charter schools, or is there any indication of where that's going for that particular age group?
Yeah, so of course, as it pertains to, I didn't take a deeper dive, and I should have done that in that situation. But initially, when we first started, I will say that I did in looking at when the outbreak actually occurred, it was found a lot in a lot of the private institutions, and as it pertains to that. But of course, what we have done when it comes to the agency, we looked at that rate as it pertains to how many as it pertains to the 45-day notices in regards to in the school system when it comes to compliance for those families to be able to have that immunization record updated. So of course, that is a good question. And of course, one of the things that I'm going to do is as we continue with this meeting, I'll be able to answer that because I'll take a little deeper dive in that.
Thank you.
Very, very good. Paul?
Kevin, I just might add to not to the measles, but remind everybody it's allergy season as the yellow stuff is starting to hit all our cars and all. So just remember to put some extra protection out there. If you got allergies, just go the extra distance and do what you got to do to stay safe this season. It looks like it's going to be a big one.
Great. Thank you, Paul. All right. Anything else for Lamar? Lamar, thank you so much for that great report. Appreciate all that you do with South Carolina Department of Health, Public Health. Thank you so much. All right, and we'll move on to our community health and wellness updates. I'm gonna call on Nick Osborne because it's Nutrition Week month, and I know he has some things to share with us. Nick.
Yeah, no, thanks ever so much, Kevin. Yeah, obviously Nutrition Month is something that we are celebrating, drawing attention to. I think you'll see a lot of social media posts going out during the course of this month. We're doing some op-eds with the Post and Courier, so drawing attention to the importance of Nutrition Month and what it is that we do and what everything else is going on in the community as well with our partners. So obviously it's going to be an important month this month. Also, maybe just to say, we did just complete our Chef's Feast a couple of weeks, well, it seems like a long time ago now, but a Sunday ago. Paul, thank you so much for joining us. And again, it was an opportunity for us to raise awareness to the issues of hunger and food insecurity, especially with a focus on childhood hunger and food insecurity. We had a very successful night that raised a lot of funding for us that enables us to put that straight back into our programs. I will say, just as another quick update, obviously this year is a year that is going to be something that we project to be a challenge, largely because of some of the uncertainty around some of the federal funding that we've traditionally received. And the unpredictability of that. But I will say that we have started the year off strong, specifically around our retail rescue program. For those of you who don't know, of the 40 million plus pounds of food that we distribute in a year, about 40% of that comes from our retail partners. So last year we distributed somewhere in the region of 16.5 million pounds of food from our retail partners. So this is food that we're able to rescue from the likes of Walmart, Publix, Food Lion, all of the range of different Harris Teeter, which enables us to take that and put it straight back into the system through our partner agencies. So we are very fortunate at the beginning of this year to have started very strong with our retail rescue program. We're about £400,000 above where we had targeted to be. So again, whilst we're challenged with the uncertainty of federal food sources, we're able to pick that up very strongly from the great collaboration and support from our retail partners and able to get that food out into the communities and with our neighbours through our partner agencies. So that was a quick update, Kevin.
Yeah, thank you so much, Nick. Yeah, great work. That's awesome. Paul?
And Nick, if tell us your website again and where they can find if they're looking for food or locations is.
Yep, just go there, very, very easy, lowcountryfoodbank.org. Just go onto the website and there's a whole host of information there in terms of finding food. So just click on the Find Food tab on there. We have a very effective, interactive Find Food platform. It's a platform called Vivery, but if you click on there, it provides a whole host of ways and means of getting access to information on where to find food. Just type in an address, a zip code, whatever's most convenient in terms of a location, and that will give a whole range of different options. And clicking on any one of those options will give a lot of details in terms of the different types of services that a partner agency or a food pantry offers, including opening times and the types of programs that they operate, and again, the distance that it would travel to get to, etc. So a whole host of information. That's for the Find Food, but then a lot of other information related to the different programs that we offer and that we do. A lot of interactive opportunities on that website. Yeah,
Kevin, if I could just one more thing to Nick. Nick and them did a presentation at the Chef Fest where they talked about the feeding of the children and the infographics of what's going on with our children and all. And Nick, I don't know if there's a publication or something out we could share or your video, but it was enough to say that people stood up and wanted to give because it was really very meaningful to our community to know we can make an impact by just stepping to the table to help out. So.
Yeah, no, Paul, let me share you the link. Paul, I'll share the link with you, and if you're okay to then share that out with everyone. But yeah, I mean, it was a video. Every year when we do Chef's Feast, we try and tell the story, and very often, and as much as possible, we're sharing that story with respect to in a very dignified way. So a lot of the theme around the story that we were telling this year was around so fulfilling the dreams of our children. Every child has a dream. Every child has a dream for what they want to be and what they want to become. And so therefore the onus is on us to be able to do what we can to provide the resources and the support that enables those children in our communities and our neighbors to be able to aspire to the dreams that they want to have in life. So that's really what the theme of that video was. So Paul, I will share the link with you and then happy for you to share that out to everyone. Everyone, please feel free to share that to anyone else as well.
Great. Thank you so much, Nick. Appreciate all the incredible work you do. It's so important. Appreciate everything you do. Thank you. And Jennifer Brush, do you have anything for community update?
I do. I've got lots of things. Good morning, everyone.
Good morning.
First, I guess I'll start with our just kind of an update about things that are changing with our agency merger with drug and alcohol and disabilities. So one of the things the state has realized is that the mental health centers are the only ones that have clinics in all 46 counties of our state. So you're going to see rolling out of us providing services from disabilities in our buildings. We're actually hiring a position for a therapist to work with mental health and disabilities, and also just collaborating more with drug and alcohol. So I don't know if y'all noticed when I signed on, I changed my name up there. It used to say OMH for Office of Mental Health, and I changed it to Behavioral Health and Developmental Disabilities because we really are kind of going to be helping to be able to make it easier for people who have any of the three needs to get all those services in one place. So that's kind of exciting news for us. Our agency is rolling out a new electronic health record at the moment. Our center starts in about a month, and that's always fun for any of you who might have electronic health records to change over to a new system. So lots of things happening with that. We're also getting ready to, here at our center, get our car reaccreditation in 2 weeks. So working hard on that. I can't not mention the conference. We have the conference at the Gilliard Low Country Mental Health Conference, July 29th through the 31st. If you haven't signed up, I encourage you to do that. We've got talks on developmental disabilities, trauma, grief, survivors of suicide, solution-focused therapy, eating disorders, all kinds of great topics. And it's always a mix of topics, which is kind of nice for people who want kind of diverse speakers. So I'll send out with Paul another link to our conference website for that. Every year we do have a group of patients that have been running the bridge run every year for probably almost 10 years now, and they're going to be doing it again this year. They're very excited. They make t-shirts and everything. Mental Health Heroes, our nonprofit, helps support them to do that so that they can do the bridge run together, and it helps in their recovery. And lastly, I think there's a mental health, we're going to be hosting, or helping, a group of us are hosting a mental health Clubhouse Forum, and it's going to be held at MUSC on March 27th. And Paul, I'll have to get you the invitation to share with the group. But we'll have a panel of speakers, and the VA's involved too. But what we're trying to do is, mental health clubhouses are a national fidelity program, and they're places for people to go for resources and support, but they're run by peers. So they're not run by professionals. So it's different than the Hope Center or the Navigation Center. It's a place where people can go and just get lots of different things, even and just interact with each other. We don't really have a place in Charleston anymore. We had some places for patients to go, maybe that live in group homes and things during the day, just to keep busy and do things that are constructive and work with each other. And we've been missing that for a while. So we've got some folks helping us from Clubhouse America, I think they're called, trying to find a way to help fund and find a place for a Clubhouse program. We'll be hosting a forum in Berkeley and Dorchester counties as well. But when I send the information out, it'll have more information, but we really are looking for community support for some of our folks who are living with mental illness and really need some more positive things and supports for them every day. So that information will be coming out soon. And I guess for us, other than that, we're just very busy working and like the rest of you. And I'm really just, again, happy to be part of this group.
Whoops, I had to come off mute. Sorry. Thank you so much, Jennifer. Appreciate all that you do. Great work. Jonathan Kessler, do you have any follow-up from your side?
Hi, good morning, everybody. So I'm with the VA, and I'm really looking forward to the Low Country Mental Health Conference. We're going to be able to table this year. We're missed it last year, so I'm really looking forward to sharing awareness of VA suicide and other benefit programs that we offer our veterans and their families. Speaking on that note, every year the VA does publish a suicide prevention report. The 2025 report that, of course, looks at data and all that accumulated from 2 years prior is looking at 2023. So it trends alongside pretty well with what we look at as our non-veteran population as well, unfortunately. So our younger veteran populations are at greater risk of dying by suicide. And about 60% of those veterans that are not affiliated with the VA or hadn't been in the last year, it's a much greater rate that they're dying. So the role that I'm in is working within the communities to help support those veterans with different programs and agencies similar to what y'all provide, is providing suicide prevention. So like Nick's program, if somebody doesn't have food or is food insecure, that is potentially could be a risk factor, right? So anyhow, I will drop in the link to that report. It's not as, it doesn't have a lot of graphics and things because it was late in being released. So the national office is still looking at that. But the bottom line is that we're still facing, a great suicide risk at greater numbers with our veteran population, which is a much smaller population compared to that of our non-veteran population. So the numbers are greater in terms of rates. So we still have a great amount of work to be done, and it really is a public health approach. As we look at this, it's non-discriminatory, and so it's really boils down to looking after one another. And there's various courses and classes I know through Office of Mental Health. They have their BHDD has their program. The VA also offers a 1-hour suicide prevention course. Is a gatekeeper program for non-mental health professionals because it takes really each and every one of us to look after one another. And Joyce Antonetti had reached out to us, and I know she's promoting in part of the board for the Low Country. I'm not going to steal her thunder, but we're going to be providing 2 SAVE courses within that conference that's coming up at the College of Charleston, I believe next month. So I'll drop a link if anyone's interested. And if anyone would like, in this particular forum, just kind of a general overview, I'm more than happy to share that information and kind of whittle it down from its 60 odd pages to something a little bit more manageable, just for a takeaway as the prevalence and what the VA is doing and what we hope working with the community can help to move the needle in the right direction. Thank you, Kevin.
Great. Thank you so much. Appreciate it.
Yes,
All
sir.
right. Anyone else? Anyone else want to share? Paul.
I'm going to jump in there because you said it at the beginning, and this goes with everybody's health. I want to make sure that everybody knows that you can volunteer, you can walk, you can run, you can do anything you want with the bridge run. And it's all are welcome. Mayor Riley always used to say, this is the jump start to health for our community every year. And so I just want to tell you, there's lots of ways to be involved. There's this link, or you can go to the bridgerun.com site and click on it. We heard a little bit about nutrition and a healthy body and getting ourselves ready for the run. Again, this is a reminder that we can all do it. We just got to get over it. So get on the bridge, register, and come out and join us, whether it's volunteering at the expo, which is open to everybody, on the 26th and 27th. We're up at the Charleston Area Convention Center, and Bridge Run Day, we're out here. We're ready to welcome. We expect about 40,000 this year. So you can see the crowd at Bridge. I'm at the finish line, and let me tell you, once they start coming, they just keep coming and coming and coming and coming. So we're there to wave at you and say, you made it. So
Great.
come out and join us.
Paul, thank you for all the incredible work you have done and always do, for the Bridge Run. You work your tail off, and it's one of the biggest events, and certainly the city of Charleston and Mount Pleasant both benefit greatly from that, and just appreciate all that you do. And yeah, hope that everybody will come out and participate. I see Lamar has his hand back up. Lamar?
Yes, before we exit, I just wanted to go back to the question in regards to what Ms. Joyce asked, and just to let her know that, of course, yes, it is a little more prevalent into this, not only just the public school system. There was some areas that identified back in February, at the late February, where they had for a whole school co-op, as it pertains to where they are finding finding the measles to be prevalent there as well. Oftentimes in situations, also to make some corrections that I mentioned. So the briefings are usually on Tuesdays and Fridays. And then, of course, as it pertains to, but however, in the situation of it being prevalent in those areas of the schools, it's more, we're realizing that there are more numbers that are increased based on public areas. As you can see through the list of the ones that were listed, and that's only because in the situation most people that are possibly not in reference of remembering that it still lingers there after 2 hours. So in the same sense of, hey, yes, we're here. We left the grocery store. My family went home. However, there's another family that comes in that same grocery store, and then of course it all affects them as well. So, which is why we go in a space of going back to speaking of what I mentioned to Kevin in regards to, yes, you want to be able to be in those cases of understanding of, hey, if I'm checking this website and being able to be aware of where those areas are. I can make the proper precaution of saying, hey, maybe after that 2 hours, or 3 hours, I'll take that precaution. I'm going to pick up my prescription now, just because of those reasons. But yes, they are looking at it as that area of for those students from ages group from 5 to 11 is where it is prevalent there, but it is a lot in the school systems, especially a lot of the academies down there, as well as the private institutions as it pertains to where it's connected with a lot of the churches who have child care centers as well.
Thank you so much, Lamar. Appreciate that. All right, Susan Johnson.
Yes. I just wanted to say, I hope that folks saw our announcement that went out on Monday of this week, that we officially have relaunched the South Carolina Healthy Business Challenge as a coalition. And I think most of you have been on this journey with us since we started the program in Charleston back in 2015. And we have steadily grown. In 2022, we rebranded as a statewide program, and we now are stepping into the new chapter as an organization. So we are officially the South Carolina Healthy Business Coalition. We have our 3-seminar spring seminar series coming up at the end of the month. And as part of those seminars, we will also hold a press event at each of those regional seminars to announce and celebrate the coalition launching. So I will send out the information on those seminars. The one that's in Charleston will be on March 31st at Alhambra. And the topic of our seminar series is Nature at Work, which is the initiative that we launched last year that I had presented to this group around nature-based health promotion. So we're really excited about the growth of what started out as a small regional citywide program. Paul and I put in a lot of time and hours to build this, and it's exciting to see where it's grown. And then we're also kicking off our third cohort of our fellowship program tomorrow, and we have 11 leaders from across the state that will be engaging with us over the course of the year. So our new website is up and it's live, so check it out, and we hope to see you at the event on the 31st.
Thank you so much. All right, very good. Anyone else?
I just have one more thing. Sorry.
Yes, please share with us. Thank you.
Just to touch base, Jonathan mentioned that the Student Health and Wellbeing Consortium, with the collaboration of our four-year universities here, as well as Trident Tech, will be May 19th. He will be doing the presentation of the SAVE program. And actually, Ms. Susan Johnson will be our keynote speaker. So got a lot of collaboration within this group, and I really appreciate everybody participating and networking with me on helping get that planned. I think it's going to be a really, really great turnout. It will be at the College of Charleston and the Rita Science Building. And I'm looking forward to seeing how we can better support our students across the region for, making sure that they are well and that they're meeting all the resources that are available are being utilized by them. So I appreciate you guys being a part, letting me be a part of this and promoting that particular consortium. And I look forward to the next meeting.
Great. Thank you so much, Joyce. All right. If there's nothing else, I just want to say thank you again to everybody. Thank you. I know your time is very, very valuable, and it's valuable to us at the city of Charleston. And we know how fortunate we are to have the expertise on this committee. And just want to say I can't express enough how much we appreciate you. So thank you all very, very much. And if there's nothing else to come before this committee, we stand adjourned. Have a great March. Thank you.